Before watching our videos, please subscribe to our channel and then tap the bell button, so that you can receive our new videos notification fast.
What is systemic lupus erythematosus? Determining factors. Genetic factors. Systemic lupus erythematosus has a significant link to the HLA-DR3 and the HLA-DR2 genes that code components of the complement system, relation with deficiency of C2 and C4. The HLA, human leukocyte antigens, are molecules in all cells in a person's body. They allow the immune system to differentiate between what is their own, to not attack it, and what is other, to attack it. The complement system comes from molecules with the goal of eliminating anything that others. Hormonal factors. The greater prevalence of systemic lupus erythematosus in women of childbearing age than in men has led to the idea of a link between sex hormones and the illness. Therefore, one's own hormones, estrogen, progesterone, prolactin, testosterone, and others' hormone replacement therapy or contraceptives seem to play an important role in the disease, while there is no consensus on the significance of the influence. Environmental factors. Some environmental factors seem to have the ability to trigger or intensify systemic lupus erythematosus. UV radiation, associated with the photosensitivity, exaggerated response to sunlight, that is, symptom of the disease and outbreaks after prolonged exposure to the sun. Viral infections, such as Epstein-Barr or a retrovirus. Medication-induced, where the symptoms could be due to certain medications affecting the immune system. Something that happens with procainamide, antiarrhythmic, or hydralazine, used to treat hypertension. Pathogeny. The final result is the creation and deposit of immune complexes in tissues of the body. Immune complex is the name given to the molecule resulting from the antigen-antibody union. This deposit is one of the main mechanisms by which the tissue lesion is produced, along with the inflammation and apoptosis, cell death, processes that come from the abnormal immune response. Systemic lupus erythematosus. General symptoms: 95%, fatigue, lack of appetite, weight loss, overall not feeling well. Joint pain is almost constant. Musculoskeletal manifestations: 95% consist of muscle and joint pain. These are the most common symptoms. Skin lesions: 80% of cases, more than half of people with lupus present with photosensitivity. Skin lesions may present in any of three ways: acute cutaneous lupus, 50% one of the lesions that is most characteristic of the disease, facial erythema, redness in the face, in the shape of butterfly wings. It doesn't leave a scar, and its appearance relates to the sun and new outbreaks. It may sometimes be accompanied by a red rash in other areas: neck, shoulders, arms. Subacute cutaneous lupus: 10% symmetric blisters appear on the neck and shoulders with sun exposure. They don't leave a scar, though may leave a discoloration of the skin. Chronic cutaneous lupus: 30%, almost half of patients present with ulcer-like lesions in the mucous membrane of the mouth and nasal cavities. Blood alterations: 80%. The most common is chronic anemia. Neurological manifestations, such as headaches, depression, anxiety, convulsions. Lung manifestations, in half of patients. The most common is pleuritis, and the most serious is a massive alveolar hemorrhage. Fortunately, it is very rare. Cardiac manifestations: the most common is pericarditis. Lupus nephritis. It affects half of patients and is a bad sign. Many other manifestations may present, depending on the affected organ, such as miscarriage, keratoconjunctivitis,